Okay, are you ready? Let's start the second session. So welcome again, welcome aboard. First title is the moxibustion. Moxibustion is a heating stimulation. Is treated and prevent disease by mainly use the Moxa flows. The combustion of the Moxa flows permit the transmission to the heat to the acupuncture point in other part of the body, has various pathological changes. So it is a kind of the external therapies to treat it and prevent disease and promote health chi of the bodies. Moxibustion can produce effect of the traditional theories, warm meridian, and expel the wind, cold, damp. And for wind cold exterior syndrome and for interior cold syndrome is a target problem by the moxibustion treatment. And then the mechanisms regulate qi and blood circulation and revive the yang for the rescue situations. So the prevent disease and keep healthy and remove the toxic heat. Nowadays, modern research is the thermal and radiation effect and the pharmacological actions. So this is often done in the conjunction with classical acupuncture to improve the clinical effect, particularly in condition of weakness, such as chronic disease and exhaustion and hypertension and depression and asthma. Moxibustion mostly used the Moxa or the Mugwort half, the Artemisia and Vulgaris. Vulgaris is Moxa and the Mugwort is popular use. It helps the warm meridian and expel the cold, damp, and move qi and blood circulation and open the closed, blocked meridian flow. And some other flammable materials are used, but its popular is Artemisia vulgaris. It helps to the warm area of the body with the intention of stimulation, circulation, and lymphatic flow. And it also helps to smooth the flow of qi and blood and expel the cold and the pathogenic influences. But the smell of the moxa in the Artemisia vulgaris is very distinct, and many people find it to have a therapeutic and relaxing the aroma. There are two types of moxibustion. Is a direct moxibustion and indirect moxibustion. Direct moxibustion to make scarring is non-scarring. Indirect is use the moxa stick and the modern instrument is. Direct moxibustion means the moxa contact the skin, practice directly. And for the indirect moxibustion is evaporated substance such as ginger, garlic, or salt are placed between the skin and the moxa. This one is a direct moxa. And indirect is the vaporing. This one is the ginger. And the moxa stick and warm acupuncture used. Moxa stick is a long, just like a cigar shaped stick is made by the rolling and the compressing the moxa flow. And the acupuncture is combined acupuncture and the moxibustion. Needle inserted on the acupuncture point and the tip of the needle put into the moxa cone. And the bone is the mechanical and thermal stimulation on acupuncture point. But traditional moxibustion treatment was done by the burning mugwort. Some cases is the smell, is smoke. Those who weak respiratory system, the uncomfortable with the smell. And the elderly, the people with weak skin are at the risk of burn. So it should always be careful. So recently, the moxibustion treatment device has been developed that make moxibustion treatment more convenient and safer. So especially in Japan and Korea. So it is the modernized smokeless moxibustion without odor or smell. This one is Bansin, is a Japanese acupuncturist developed this one. This one is a thermal instrument, the modern moxibustion, made by the Korean, the expert and the Korean researchers. Moxibustion is mostly used for syndrome of cold and chronic disease, and the disease caused by the prolonged yang deficiencies. So the target disease of moxibustion are pain, paralysis, and skin disease, and digestive and gynecological diseases. And the pattern is cold syndrome and chronic disease, yang deficiency, and prolonged disease. And the syndrome is of the excess heat. And disease is pain, paralysis, skin, digestive, and gynecological problems. But it's the contraindications. First one is the patient's state. The second one, the disease, contraindication, and location is the contraindications. Moxibustion is not advisable for senile the people or children who do not respond well to moxibustion stimulation, or in case of faint and diminish the consciousness and make the excess heat syndrome and floating the pulse. That cases do not respond immediately to the contraindication of moxibustion. And the caution must be taken by the performing moxibustion with diminished consciousness, and sensory disorder, mental disorder, and diabetes, something like that, or circulatory disorder. And one should avoid applying the direct moxibustion to the facial area and ligament and the area of the large blood vessels. And the disease is something like the sensory, mental, the sensory disorder that makes the burn, and diabetes also to make a burn. And the circulatory and acute infection is avoided moxibustion. Inflammation and scarring due to the burn injury are the most common adverse effect of moxibustion. The resin and the smoke caused by the Moxa combustions that may induce the allergic dermatitis or respiratory disease. If adequate the care is not given upon the worsening of the burn injury, that patient may suffer the sepsis. Next is the herbal medicine and drug therapy, and just known in the botanical, the medicine, and the phytotherapy or the phytomedicine that involve the using a plant or part of a plant for healing purpose. The herbal part of the remedy, it may come from the leaf and the flower, stem, and seed, root, fruit, or the bark of the plant. And it may be used to treat wounds and the range of the other conditions. The herbal medicine comes in the variety of forms and may be applied internally or externally. And externally used ointment. And the herbal remedies that are taken internal liquid, liquid herbal extract, and the tea, powder, and capsule, and tablets. And the herbal remedy are applied external include baths and compresses and plasters, oil, ointment, and wraps. Herbal medicine, unlike the Western medicines, show the parasitical activities through the activation of multiple sites of action by diverse components. Each prescription may have contraindication or the precaution according to the qi and taste of the ingredient and patient conditions. For example, this one is ephedra, herba ephedra. This medicine use, if not appropriately, the urine intention and sleep disorder, the palpitation and nausea, vomiting may occur. This medicine should not be used with the myocardial, the excitatory drugs such as digoxin or antidepressant such as monoamine deoxidase inhibitors. And those of the herba, the ephedra, should be decreased where it is administered with the bronchial asthma drug and increased when it is administered with the tannin-contained drugs. Another one is warfarin is a big problem issues, and the warfarin is a major anticoagulant drugs that may be reinforced or inhibit drug due to its the coagulative effect when the co-administered when a herbal medicine and antibiotics in acute inflammatory disease may have enhanced or inhibit the antibacterial activity the following the co-administration with the herbal medicine. So it's a kind of the contraindication with the causes. Next is the herbal acupuncture therapies or the aqua acupuncture, pharmacopuncture. Is a combination of the acupuncture and the herbal medicines. The pharmacopuncture is a unique therapeutic technology in Korea medicine, and they permit the treatment of disease by injecting the drug that have been refined and extracted from herbal medicine into the acupuncture point. Pharmacopuncture applied the physical stimulation through the meridian and acupuncture point associated with the pathological organ and the lesion. And it is also applied the chemical the stimulation via the selection of the herbal drugs according to the key and taste theory of the herbal medicine therapies. So it's a synergies effect. Acupuncture is a physical stimulation, and the herbal medicine is chemical stimulation. One of the popular treatment is Venom therapy. Venom acupuncture is old-fashioned. Venom is now the modernized injections. And venom therapy is medicinal application of venom from honeybee into the human body for the treatment of some disease such as rheumatoid arthritis and the pain disorders. The venom therapy has been used in alternative medicine for more than 5,000 years. It consists of either indirect application by extracting the venom with the electrical stimulation, followed by its injection into the body or directly the bear, the honeybee stings. It contains both the anti-inflammatory components and the inflammatory compound, including enzyme and sugar and mineral and amino acid. As acupuncture theorist, the strong stimulation in children and elder and the fatigue patient or the excessive injection should be avoided. And injection in the lower abdomen or lumbosacral area is prohibited during pregnancy. And caution should be exercised in the case of the dermal infection, edema, and blood-related disease, such as the severe coagulopathy and drug hypersensitivities. And venom acupuncture is normally advised against in cardiovascular, the kidney disorder, and asthma, and the infectious disease, such as the tuberculosis. And the caution should also be in pregnancy and diabetes and the allergic dermatitis and epimenorias. 1 to 10 people in every 100,000 may present systemic immune response reaction within 15 minutes after venom acupuncture injection. And the systemic reaction include chills, and fever, and ache, and urticaria, and itching, and nausea. In severe cases, and dyspnea or shock may occur. So in that case, patients may require epinephrine or antihistaminic therapies. Next one is the Chuna. The Chuna Qigong therapies. The Chuna is a kind of the manual therapies. It's called the Tuina in China. In Japan is the Anma, massage, shiatsu, and judo therapies. In the United States, in the chiropractic and osteopathic medicine. It's very similar to the Chuna in Korea. Chuna is therapeutic massages that address the mechanical function and pathology and diagnostics and theory related to the treatment in order to maintain the balance in orthopedic structure and functions, and the structure abnormality adjusted by the Tuina. And the therapeutic method is a passive method approaches and active approaches, the exercise therapies, and balancing the imbalance of the muscle dynamics and the visceral function and the circulation of the qi and blood. So in 2005, in Korea, Chuna was approved for the coverage by the car accident insurance. And 2019, and Chuna began to reimburse in national health insurance after 2 years of pilot coverage project. The indications are diverse from the peripheral and autonomic nervous system disorder and the pain syndrome caused by the spondyloarthritis and the vertebral disc herniation, muscle and the tendon sprain, and neurologic the myalgia, headache, and insomnia, the exercise, the rehabilitation for paralysis. Chuna therapy has contained the strong passive exercise may occur the adverse effect due to inadequate and hand technique or motions. So often the soft tissue injury, bleeding, and fracture and skin infection, inflammation is a contraindication of tuna therapies. And disease with hemorrhagic tendency, internal organ injury, acute infectious disease, woman menstruation, pregnancy, and the neonatal period, and the fracture is a contraindication of the tuna therapies. And the practicing in the qigong and the tuna in the incorrect posture may induce the neck pain and neck stiffness and the shoulder pain. So training excessively while the yang deficiency may cause coldness, chill, and cold sensation in the bodies. Next is the thread embedding the acupuncture. It is a special type of the acupuncture that is insert certain the medicinal thread into the subcutaneous tissue or muscles at the specific point. The purpose of the prolong the therapeutic the stimulation. Thread embedding acupuncture provide the physical effect and chemical effect, and the physical stimulation and the chemical stimulation. The physical stimulation is referred to the continuous the acupuncture point stimulation after thread the insertion, and the chemical stimulation report to the tissue damage caused by the thread injury and the insertion, and while result in the aseptic the inflammation reaction and ultimately promote tissue regenerations. In East Asia, including in Korea and China, and the thread embedding treatment has been used for the treatment of musculoskeletal the pain, such as the frozen shoulder and chronic low back pain, and osteoarthritis of the knee, and sometimes obesity and various chronic disease, owing to its long the lasting effect. Now, recently, the thread embedding therapy has been widely used for the cosmetic the purpose, medical cosmetic the modality, such as reducing the skin wrinkles and tightening facial skins. Next one is the cupping therapies. The cupping is one of the oldest the medicinal textbook in the world. As you can see, the Eva Papyrus described how the ancient Egyptian they used the cupping therapy in 1550 BC. The cupping therapy is one of the most widely used traditional medicinal method, which creates the partial vacuum in cups placed on the skin, either by the means of the heat or the mechanical devices. In the Middle East, cupping therapy has been used since the 1550 BC and widespread by the Muhammad, so as the hijama. And East Asia, the cupping therapy has been used since Han Dynasty and developed to the sliding cupping and the medicated cupping and the retrained cuppings. And in Europe, and the cupping also has been used since the Greek era and developed as the cupping therapy in many the European countries. Now these days, the cupping devices are commonly used in traditional therapies through the various the techniques. There are three main types of cupping: is the dry cupping, and wet cupping, and flame cupping. this one is the plain cupping. It's dry cupping and wet cupping. Dry cupping means is suction only, just suction only. And wet cupping is wet means a kind of the bloodletting. So involving the both suction and bloodlettings. Plain the cupping and they use the fire to create the vacuum inside the cup. Cupping may be applied to treat various conditions, including excess syndrome, blood stasis, and the common cold, and wind dampness, pain in the limb, back pain, and sprain, and headache, and the coughing, and lead swollen pain in the eyes, and hypertension and headache, and early sore and ulcer. The procedure is prohibited during the high fever and convulsion, fracture, or on the low abdomen during the pregnancy. And skin, the hypersensitivity and infection and bruising or skin ulcer should inspire the caution. Discretion should be used when the patient has severe coagulatory therapies, heart disease, or the systemic anemia. And excessive and repeated wet cupping may cause anemia. If a blister forms after cupping, the exudate is drained with a sterilized 3-edged needle, and the infection and ointment and dressing or other appropriate care is applied. The side effect is the mild discomfort, burn, bruise, and skin infection. So this one is the disposable cupping device to prevent the wound infection as a medical device. The medical device means the contact to the blood. So it is required the use of the single-use disposable cup. And this single-use cup can be utilized very safely, and any specific adverse event hardly occurred. So in Korean, the cupping therapy, the Korean medical doctor used the disposable, the cupping cups. So the material is covered the national insurance healthcare system. It is more popularized the disposable acupuncture, the cupping cups use. So I think it's a very useful and reasonable approach to use the disposable, the cupping therapy, the covered the insurance. Okay, this is the end of my lectures. I hope this lecture acts as the good reference for the health technology of traditional Korean medicine and promote the popularization of the Korean medicine and the Korean medicine modalities in many countries, especially for your countries. Thank you very much.